All right, guys. So, chapter 7 in your comprehensive medical terminology book, we're going to be talking about muscles and joints. So far we've talked about whole body terms and also the skeletal system. So, chapter 7 kind of goes over the muscles and joints that kind of form over that skeletal system, right? Okay. So, a muscle overview. So, muscles are made to support and maintain body's posture through a low level of contraction. So, think about a muscle, right? So, if you're work out or have ever worked out, right? Whenever you, let's say, lift a weight, right? Our brain tells our muscles to move something, and that helps our muscles to contract, right? So, that's kind of how they work in keeping a support for our body. There's small contractions in our muscles, some that we cause unknowingly, right? Um, that help to keep and maintain our body posture. So posture, think of posture, sitting up straight, standing up straight, that type of thing. So skeletal muscles produce a substantial amount of heat when they contract, right? And there's more than 600 muscles in the body. It's like quite a few. So we have skeletal muscles, these attach to the bones of the skeleton, and they're voluntary. Okay, so involuntary and voluntary is a term that you're going to hear quite a bit with this chapter. So voluntary is something that you are able to do, right? So you make those muscles move. Okay, they're striated in appearance. It operates under conscious control, so it's something that we control, and many work in pairs, so like an opposing action. So one muscle contracts while another relaxes, and then kind of vice versa for an opposite movement. Then we have smooth muscles, which are also called visceral muscle. These are involuntary, so you don't have to think about moving these. They do it unconsciously. Okay. They're not striated, they're not under conscious control. These are in the walls of hollow organs and tubes. So think of like your esophagus or your colon or your stomach, right? That type of thing, your intestines. It's something that moves without us really knowing about it. So contraction controlled by hormones and the atomic nervous system. Okay. Not atomic, autonomic. Sorry. That didn't look right. Okay, anyway, moving forward. And then we have the cardiac muscle. So this is a specialized muscle. It forms the wall of the heart. It's an involuntary muscle, right? It's controlled, kind of on its own. So it's controlled by that autonomic nervous system, and it's striated in appearance. And then we have tendons, so the attachment of muscles. So tendons, they attach the muscles to the bones. The fascia, so the fascia is a sheet or sheets of fibrous connective tissue around muscle fibers. And then there's a point of origin. So this is where the muscle attachment is made to the less movable part of the skeleton. And then there's a point of insertion where the muscle attachment is made to the movable part of the skeleton. So this is that bicep muscle. So this is the body of that bicep muscle, right? This is a tendon, okay? And this is inserted into or connected with insertion to the bones of the lower part of the arm, that radius and ulna, right? And then this is an origin. So yes, we can move our shoulder, but this is going to be a less movable part than this one. Okay. All right. So true or false? Of the three types of muscle, cardiac is the only one that's voluntary. True or false? All right, that is false. Good. So skeletal is voluntary. Cardiac muscle and smooth muscle are involuntary. So this resulting in our not having to consciously think about such an action as making our heart beat or moving food through our digestive tract. All right. So muscles of the head and neck. So we have the buccinator, right? Always reminds me of the dumb hamburger at Wendy's whenever we talk about this. It's the baconator, Right? I know that's dumb. Anyway, so this is located in the fleshy part of the cheek, and it assists in actions such as whistling and smiling. So we have all of the, whenever you smile, right? Those are the muscles in that fleshy part of your cheek. And then we have temporal muscles. So these are located above and near the ear, and these help assist in chewing, right? So they're going to pull that mandible up as we chew. And then we have the masseter, or which is located at the angle of the jaw, and this raises the mandible and closes the jaw. Okay, so remember the mandible is that lower jaw that is movable, right? And then we have the sternomastoid. So it's also called the sternocleidomastoid. Sure. It extends from the sternum upward along the side of the neck to the mastoid process. So if you remember when we looked at the skull, that mastoid process is right behind your ear, right? So this is a muscle that extends from the sternum way down in your chest bone, right? Upward along the side of your neck and to that mastoid process. So it's a pretty long, lengthy muscle. And this assists with actions such as bending your neck and turning your head side to side. And then we have a trap. So this is a muscle of the upper extremities. So a trapezius, right? So this is a triangular shaped muscle. It extends across the back of the shoulder. It covers the back of the neck. It inserts on the clavicle and the scapula. So remember, the clavicle is your collarbone and the scapula is your shoulder blade. Good job. So this assists with shrugging of the shoulders. So when people work out quite a bit, right, they have those huge traps. Those are kind of those big muscles that are linked to the neck, right? And then we have this latissimus dorsi, which originates from the vertebrae of the lower back. It crosses the lower half of the thoracic region. It passes between the humerus and the scapula. So the humerus is that long bone in your arm, and the scapula is your shoulder blade. It inserts on the anterior, which is the front, right, surface of the humerus, and it forms the posterior border of the axillae. Okay, so this allows moving of the arms as like a swimming motion. Okay, so if you do like a swimming motion, not a doggy paddle, but a swimming motion, right, kind of like that windmill motion, that's what this muscle helps to do. All right, so then we have the pectoralis major. Okay, um, this is a large fan-shaped muscle. This crosses the upper part of the front chest. It originates from the sternum and it crosses over to the humerus, and this allows adduction of the arm. So these are your pecs, right? So for men, that's their chest, right? That's kind of what they build up. For women, we still have that pectoralis major muscle. It's just the muscle that's under our breasts. We have a deltoid, so this covers the shoulder joint. It originates from the clavicle and the scapula. It inserts on the lateral, so away from the midline side of the humerus. It allows abduction of the arm. So we're going to talk about adduction and abduction here in a little bit. And this is a good site for intramuscular or IM injections. We have the biceps brachii, right? So, or brachii, however you want to say it. So the muscle has two different heads. It originates from the scapula, okay? It inserts into the radius, and it allows flexing of the lower arm. So think about that. The scapula is the shoulder blade, right? And it inserts into the radius, which is the thumb side of your lower arm, that bone, okay? And then we have the triceps. This is a muscle that has three heads. It originates from the scapula and humerus. It inserts onto the olecranon process of the ulna at the elbow, and it allows straightening of the elbow, as in boxing. So, like moving your arm out, like pushing your fist out, it helps to straighten the elbow. Okay, so this is kind of this muscular man guy here. Okay, so we're going to talk about these. So here's those frontalis muscles, that temporal muscle, right? This masseter right here with the this mandible, right? there's those sternocleidomastoid muscles here that originate at the sternum and then go up to that mastoid process behind your ear. This is your trap. These are your traps, right? This is your deltoid. Okay. This is your pectalis major. These are your biceps. Okay. Here's your rectus abdominis, right? Abdominis, however you want to say it. Let's see. That's about it. Good. Good, good, good. And then this is from the back, right? So here's your trap. This is kind of where those traps connect, right? Your deltoid that connects with your scapula. Good. And then there's that latissimus, however you want to say it, dorsi, right? And there's the back of there's your triceps. Okay. So biceps in the front, triceps kind of in the back, right? All right, so question, if you have a tension headache and the back of your neck feels like it's in a vice grip, which muscle is most likely responsible? What do you guys think? Is that your trap? Is it that sternocleidomastoid, the bicep, or that latissimus dorsi? What do you guys think? I'm going to say A. Good. Yep. It's the A. The trapezius muscle covers the back of the neck and shoulders, which is where the most tension kind of goes, right? So it causes tension headaches that occur there. All right, so muscles of the lower extremities. This is the fun one, the gluteus maximus, which is your bum, right? So this forms most of the fleshy part of the buttock. It originates from the ilium and inserts into the femur. Okay, so the ilium is that hip bone, right? And the femur is that large bone in your thigh, and it extends to the thigh, or it helps to extend the thigh. And then we have the gluteus medius, which is located above the upper outer quadrant of the gluteus maximus muscle. So this is a site for intramuscular injections. So that's, like I said, we don't really do that here at school. We do the intramuscular on the deltoid muscle, but this is kind of that I hate to even use this word, but the only thing I can really associate it with is, when somebody says somebody has saddlebags, right? That's kind of that muscle right above your butt, basically. So it originates from the posterior of the ilium, which is the back part, right, of the ilium, and it inserts in the greater trochanter of the femur. And then we have our quadriceps. It forms the anterior part of the thigh. So that's the front part of your thigh. It helps in extension of the thigh. Okay, so it helps us to extend our thigh. And that's a group of 4 different muscles. So think of quad, right? Quadriceps. And then we have our hamstring muscles. So this is located in the posterior part of the thigh, which is the back, right? And this can be felt behind the knee. It assists in the flexion of the leg on the thigh and the extension of the thigh. And this is a group of 3 different muscles. And then we have this gastrocnemius, sure. So that's the main muscle of the calf. It attaches to the heel bone by way of the Achilles tendon, and it's used to plantar flex the foot and flex the toes. So plantar flex would be like pointing your toes down, okay? And then we have this tibialis anterior, which is positioned in the front of the leg, and it's used to dorsiflex the foot and turn the foot inward. So dorsiflex would be to point your toes up, right? And to point and to push your toes kind of towards the midline of your body, right? All right, so here's those adductors, right? So adductors of the thighs, right? What every woman wants to figure out and get super fit and trim, right? Here's that rectus femoris, or that femur muscle, right? That muscle on the very front of our thigh. Okay, here's our patella, which is our knee bone. And then we have these patellar ligaments, which attach our kneecap, it attaches our kneecap to those bones on the upper and lower part of our leg. Let's see. That's about it on that one. Good. Here's the back part. So here's your gluteus maximus, right? So that major part of the buttock. Here's that gluteus medius. You guys know what I'm talking about now, right? Here's your adductor magnus again. Let's see, that calf muscle back here, that gastrocnemius, whatever you want to call it. And then the Achilles tendon. So this is a huge tendon that runs from the heel of your bone or your calcaneus all the way up to your leg and attaches there. So if anybody knows the story of Achilles or maybe watched the Disney movie Hercules, right? When Phil says, "Oh, that fleshug of a heel of his," right? That's kind of what in Greek mythology Achilles was known for, was he was this super strong warrior until somebody like hit the back of his leg and broke his tendon and he wasn't able to move anymore. So it supports a lot, right? It's a big tendon that helps with a lot of movement. Hard to walk without it. So question, a runner suddenly grabs the back of his or her leg in pain. Which muscle group was injured? What do you guys think? The back of their leg, the back of their thigh? Doesn't really specify, huh? Let's see what it says. So it's C, the hamstring group. It's located on the posterior surface and can be felt behind the knee. So it's that hamstring. We'll go back a couple and I'll show you guys. It's this right here. These are the hamstrings here. Okay. All right. So pathological conditions when it comes to muscles. We can have muscular dystrophy. So this is a group of genetically transmitted disorders. It's characterized by progressive weakness and muscle fiber degeneration. And there's no evidence of nerve involvement or degeneration of nerve tissue. Then we have polymyositis, right? So this is a chronic progressive disease affecting the skeletal muscles. It's characterized by muscle weakness and atrophy. So atrophy is like the breaking down of a muscle. Rotator cuff tear. So this is a tear in the muscle that forms a cuff over the upper end of the arm. A rotator cuff helps to lift and rotate the arm, and it also helps hold the head of the humerus in place during abduction of the arm. All right, so this is a bursa, right? And it's filled with fluid. It helps to make things move well, right? And this would be considered a rotator cuff. So if somebody gets a tear in the rotator cuff, they have a hard time lifting their arm at the shoulder because it can sometimes get caught. It causes quite a bit of pain, but it's a pretty easy surgical fix, but it does take a little bit of recovery and like physical therapy. So true or false? The term muscular dystrophy means development of bad muscle, while polymyositis means inflammation of many muscles. Is that true or false? That's true. So both diseases affect the skeletal muscle, but their effects are very different. All right, so then we have diagnostic techniques and treatments and procedures when it comes to the muscles. So we have the electromyography, which is the process of recording the strength of contraction of a muscle when it's stimulated by an electric current. And then there could be a muscle biopsy. So if something's going on, they can take a small specimen of muscle tissue, usually through a biopsy needle or a small incision biopsy. And this is for the purpose of examining it under a microscope to kind of see what's going on. So the anatomy and physiology of joints. So joint, you think of the word articulation, okay? So this is a point at which two individual bones connect. So we have joints kind of all over our body, and joints determine the degree of movement, right? So a suture is an immovable joint. So that's the purpose of an immovable joint, is to bind bones together. So like in our head and our skull. Then we have fibrous. This is when the surfaces of the bones fit together, closely together, and they're held together by a fibrous connective tissue. So this is an immovable joint, meaning it doesn't move, right? So an example of this is the suture between the skull bones, just like I was talking about a minute ago. So these are sutures, right? So like I said earlier when we talked about the skeletal system in the previous lecture, when babies are born, these are all kind of separated, right? And it's for the purpose of going through the birth canal, right? But as we grow, these things become a little bit harder, and these sutures or these joints are joined together to make our head the shape that it is. Then we have cartilaginous or cartil. It's cartilage, right? Bones. These are bones. Sorry, this is where bones are connected by cartilage. So these are limited movement joints. So the symphysis, which is that little tiny piece of cartilage between the pubic bones of the pelvis, like I was talking about it. Whenever a woman's in labor, there's different hormones that kind of go into play, right? And it'll kind of soften up that cartilage, and it's able to expand so that the baby can fit through. Yeah, so this is that symphysis. Again, this is that iliac bone. This part right here is that iliac crest, right? This is your tailbone, and here's that symphysis joint. And then we have synovial joints. So this is a space between the bones. So there's a joint cavity. The joint cavity is lined with a synovial membrane, and then the membrane secretes what's called synovial fluid. So if you pop your fingers, right? Can you guys hear me doing that? That's what they're saying is you're kind of popping that little membrane, that fluid, right? So that's bones are held together by ligaments, and they're a free movement joint. So think of like your shoulder, right? You're able to kind of move that in all kinds of different directions. Good. And then there's hinge, which allows a back and forth type motion. So like that's an example of that is your elbow. And then there's the ball and socket joint, which allows movement in many directions around a central point. So this is like your shoulder joint or your hip joint, right? Think of a ball. It's literally the head of that bone looks like a ball, or it's really round, and it fits into this little socket or pocket, and it's able to move around in there to create a movable joint. I'm doing it if you guys can. So, we'll talk about it more whenever we're kind of in class in front of our fun friend Leon the skeleton. All right, so this is the ilium, right? This is the femur, and this is that ball and socket joint. So this is kind of a smooth head of this femur, right? And it fits into this little socket. So you have kind of movement in all these different directions. And then this is of the arm. This is the humerus, excuse me. And this is the ulna and the radius, right? So this is a hinge back and forth movement. That's what that joint does. All right, so question, what enables our movable joints to move freely and without pain? What do you guys think? It's D. So it's that membrane that secretes that fluid, right? So that's as we get older, like I tell my husband all the time, I can hear my knees like when I walk upstairs, right? I can hear them creaking. I think I'm low on synovial fluid, right? But that's what they kind of keep things lubricated and able to move easily. But as we age, right, our bodies break down, so that can be a thing, right? Where there's no more membrane or no more fluid, and that's kind of when people get into the activity of having like knees replaced and things like that. All right, so movements of the joint. We talked about this with abduction and adduction a few minutes ago, but we're going to talk about it a little bit more in depth. So flexion, this is a bending motion. So it decreases. So think about whenever you're working out, right, and you're lifting weights, you're flexing. So you're decreasing the angle between two bones, right? So you're decreasing whenever you pull up the weight, you're decreasing the angle between two bones. So that's a flex. And then an extension, that's a straightening motion. So you're increasing the angle between two bones. And then we have abduction. So this is the movement of a bone away from the midline of the body. Again, word association, right? Abduction, you're taking something away. So you're abducting it, right? So you're going to take it away from the midline of your body. So if I take my hand and I'm lift my shoulder joint, I'm abducting my arm, right? Adduction is the movement of the bone toward the midline of the body. So I'm adding it to my body. again, word association, right? So I'm moving it towards the inline of my body or midline of my body. So that's adduction. Supination. So this is the act of turning the palm up, right, or forward. So again, word association, I always think of like a waiter serving soup, right? Supination, that's somebody that's, they're going to hold your soup or whatever with their hands or their palms up, right? And then pronation is the act of turning the palm down or backwards. So this is where the palm goes towards the, like facing the floor. And so you see the back of your hand. Then we have dorsiflexion, which narrows the angle between the leg and the top of the foot. So the foot is bent backward or upward. So this is pointing your toes towards the sky, right? And then we have plantar flexion, which increases the angle between the leg and the top of the foot. So the foot is bent downward at the ankle. Sorry, it's late. I need to go to bed. Foot is bent downward at the ankle, so it's pointing your toes. So think of a ballerina, right? They point their toes. They make as much of a point as they can so that that leg and foot are one straight line. Again, here it is, toes pointing downward as in ballet dancing. And then we have rotation. So this is the turning of a bone on its own axis. Okay. So if I rotate my head, right, I'm rotating my head from left to right. That bone is turning on its own axis. And then we have circumduction. So this is the movement of an extremity around in a circular motion. So if I take my hand, right, and I move it in a circular motion, that's circumduction. So it can be performed with the ball and socket joint. So like your hip or your shoulder. So true or false? When I turn my head, I'm rotating vertebrae in my neck. Is that true or false? Am I rotating vertebrae in my neck? That's true. So C2, also called the axis, is an important vertebra for head movement. Good. Okay, and then we have pathological conditions when it comes to the joints. So we have adhesive capsulitis. So good rule of thumb, probably one of the best word parts you'll ever need to know is itis, itis. Itis stands for or means inflammation. Okay, tonsillitis, that means your tonsils are inflamed. Appendicitis, that means your appendix is inflamed, right? Itis means inflammation. Sinusitis, that means that your sinuses are inflamed, right? Good thing to remember. So we're going to learn about something that's inflamed here, okay? So this is a shoulder condition characterized by a stiffness of the shoulder with limited shoulder movement and pain. It's also known as a frozen shoulder. It may be idiopathic or due to trauma or like a systemic disease. And there's 3 stages. So there's adhesive or painful first. So it's gonna cause you pain, right? And then adhesive. So think of an adhesive. What does adhesive do? It sticks, right? So maybe that shoulder, that joint or whatever is stuck, right? And then we go into recovery once we kind of get treated for that. We have arthritis. So this is the inflammation of joints. So itis meaning inflammation, arthur, right, meaning bones or joints, right? So this is inflammation of the joints. And then so we have ankylosing spondylitis. I need to slow down. So this is a type of arthritis that affects the vertebral column and it causes deformities of the spine. And we have a bunion or a Hallux valgus, right? So this is an abnormal enlargement of the joint at the base of the great toe. So you may see people with bunions, right? So that's a bunion that's kind of this knobby looking thing on the joint of their big toe, kind of protrudes from the inside of the foot. Oh, here we go. Here's a picture. So sometimes it can be so bad that it pushes these toes forward, right? Or towards the outside of the foot. So this is what a bunion is. Okay. So question, the treatment for bunions is surgical removal of the bony overgrowth. What is the correct term for this procedure? So we're going to take something out, right? We're going to remove the bony overgrowth. So we're going to have bunionectomy, I'm going to say. C, good. So it's simply the condition added to the suffix. So there's no combining vowel since ectomy begins with the vowel. So ectomy means the removal of, surgical removal of. Okay. Then dislocation. So this is a displacement of a bone from its normal location within a joint. It causes loss of function of the joint, and the areas that are most commonly affected by dislocation are shoulders, fingers, hips, maybe the knee, right? Some people have had ribs displaced, right, or dislocated. That's pretty painful, but definitely fixable if you see the right people. And then we have a ganglion. So this is a cystic tumor developing in a tendon, and it sometimes occurs on the back of the wrist. I've actually had one. I had one when I was like, I guess I was like 15 or 16. When I was in high school, I had it removed, but they used to call them Bible bumps, right? So it's this little like fluid-filled sac that kind of grows up between the joint in the wrist. Sometimes you can get them in between your fingers or even on your feet, like between the joints in your feet. But they used to call them Bible bumps because what they would do is they would hit it and break it with a Bible or a big book, right? And so it would pop and go away, but it definitely comes back. So the best way to get rid of it is just to remove it. And it's funny because I had one. My daughter Avery actually had one too. When she was like right before her 10th birthday, she had it out. So they right on the, and it's funny because it's right in the exact same spot her and I both had, which is weird. If you want to see my scar, I'll show you. Just ask me. All right, so then we have gout. This is defined as acute. So when we look at the word acute, it's not like, oh, how cute, right? It's acute. It's something that happens pretty rapidly, like it comes on pretty rapidly. And acute is the opposite of chronic. So chronic is something that happens over a longer period of time, right? So this gout, you may have heard your dad say, oh, I have gout, or your grandpa, I have gout. I can't have beans, or I can't have red meat, right? So this is acute arthritis. It's noted when the body does not properly metabolize uric acid. It's definitely hereditary, and it most often affects the great toe. So it's that joint where that bunion would be. That big toe is where it usually starts. That's where people will normally feel it. And some people get gout like in their knees or in their hands. It's really painful. A herniated disc. So this is the rupture of the central portion of the vertebral disc through the disc wall and into the spinal canal. So it's kind of touching all these nerves. It can be very, very painful. It's also called a ruptured disc or a slipped disc. Causes of this can be injury, abrupt movement, or degeneration of the vertebrae. So it could be caused by all kinds of different things. So this is, if we haven't talked and hung out with our friend Leon, the skeleton, this is what I was going to show you guys about the vertebrae. So this is a vertebrae or a vertebra, okay? The spinal cord comes up through this little hole, right? And this is the disc that goes in between each vertebra. And this is kind of the nucleus of that. So this, if this is ruptured, it's almost like a hernia, right? So it can push through that disc and start to hit on these nerves, and then pushes it kind of up against the bones, which can be really, really painful. This is the vertebral bone here, right? And this is the lamina, okay? So sometimes what they do is, and I'm sure it'll talk about it here in a minute, my dad actually had this done. So whenever somebody has like significant bulging discs or slipped discs or whatever you want to call it, sometimes they'll do what's called a laminectomy. So they'll take out this portion, this little spiny, pokey portion of the vertebra to cause some relief. So it gives this spinal cord somewhere to go so that it's not necessarily being pushed and causing the nerves to be kind of attacked. Okay. Lyme disease. Okay, yeah, I always wonder, like, it definitely affects your joints, but Lyme disease can affect a whole lot of everything. Lyme disease is something that is contracted to humans. It's contracted from like a tick bite, okay? They say that we don't really have it here. We don't have the right type of deer that carry those type of ticks or whatever. It's usually kind of an East Coast thing. But I have like had friends whose parents have had Lyme disease, after traveling and things like that. And they call it the Great Pretender because it kind of mimics all these different diseases. But what it is it's an acute, so happening pretty rapidly, right? Pretty like all of the sudden, recurrent inflammatory infection. It's transmitted through the bite of an infected deer tick. It's characterized by a red, itchy rash with a circular center and accompanying flu-like symptoms. So if you've ever heard the term of like a bullseye bite, right? So it kind of has that circular center and then like a lighter color at the outside of it, which can happen if you get, and it's around here. Like we have it here in New Mexico, right? We have deer and people, have cattle and horses and stuff like that. Dogs, ticks are around, right? So anyway, that's Lyme disease. It can make your joints and things like that really, really achy with those flu-like symptoms and inflammation. Okay, so question, true or false? A herniated disc is referring to one of the cushions between the vertebral bodies. If inter means between, the term to describe it must be interdiscal. What do you guys think? Interdiscal, does that look right? That is false. So the correct term is intervertebral. So that means between the vertebrae, right? Good. All right, so then we have osteoarthritis. So this is the most common form of arthritis. It results from the wear and tear on joints, so especially weight-bearing joints, such as your hips and your knees, right? Like I said, anytime I climb stairs, I'm like, I can hear my knees, like they're cracking, right? It's also known as degenerative joint disease. So this is, we have all this cartilage and those joints, that synovial membrane and things like that. It starts to degenerate, right? So like that cartilage will break down. And sometimes it can get kind of stuck and you can feel, you know what I mean? Like things kind of sticking. And that can definitely be painful. And then we have rheumatoid arthritis. So this is a chronic systemic inflammatory disease that affects multiple joints of the body and mainly the small peripheral joints. So think of like your fingers, right? Those smaller joints that are come together. Excuse me. Then we have a sprain. So this is an injury involving ligaments that surround and support a joint, and it's caused usually by a wrenching or twisting motion, right? So a lot of people get this like in sports activities, or if you're me walking, whatever. I've sprained my ankle before and it was horrible, right? Sometimes they say a sprain is worse than a break because a break will heal. A sprain kind of never really fully gets better. You can always kind of feel it, right? And then we have systemic lupus. So this is a chronic, so opposite of acute, right? So chronic is something that happens over a long period of time. It's an inflammatory connective tissue disease affecting the skin, joints, the nervous system, kidneys, lungs, and other organs. And it's characteristically has a butterfly rash that appears on the face. So true or false, the most common form of arthritis is osteoarthritis. What do you guys think? True or false? The most common form of arthritis is osteoarthritis. That is true. Good. This is simply a result of wear and tear over the years, also known as degenerative joint disease, right? Our bodies are super great, but they do break down as we get older. Not that any of you are older, but you get what I mean. So now we have diagnostic techniques and treatments and procedures for the joints. So we have an arthrocentesis. So this is a surgical puncture of a joint with a needle for the purpose of withdrawing fluid for analysis. And orthography. Sure. So this is the process of x-raying the inside of a joint after injecting the joint with a contrast medium. Arthroplasty. So this is the surgical repair of a joint. Arthroscopy. So this is the visualization of the interior of a joint using an endoscope. So a lot of people will have like a scope done, right, on their joints, and that's what this is. And then we have the erythrocyte sedimentation rate, which we talked about. Those of you that have been with me for a mod or two, we've talked about this when we did our phlebotomy mod last time. The blood test that measures the rate at which your erythrocytes or your red blood cells settle to the bottom of a test tube filled with unclotted blood. The increased said rate are associated with inflammatory conditions, and it's helpful in determining the degree of inflammation in rheumatoid arthritis. And then we have a rheumatoid factor. So this is a blood test that measures the presence of unusual antibodies that develop in a number of connective tissue diseases, such as rheumatoid arthritis. So question, an MRI of the knee shows a possible meniscus tear. The doctor opts to look into the joint with a scope. This procedure is known as a, anybody? It's a scope, right? I'm going to say D. Good. So arthroscopy. So this is the visualization of the interior of a joint with a specialized endoscope. Oh, and that's it. Okay, awesome. So there is a couple of assignments attached to this, or a couple of tests, I guess, in Cengage, attached to this assignment. So you guys need to get that done as soon as you can, and hope everybody's good. We'll talk to you soon.